Hello and welcome to Nursing School Chronicles, brought to you by the University of Texas Medical Branch School of Nursing. My name is Lauren Homan and I am the recruiter here at UTMB SOM, and it is my honor to be able to chat with current and prospective students. This podcast is a resource that has been created for current, prospective students and anyone interested in nursing school. Each episode will cover a different subject. Enjoy! Hello and welcome to UTMB Nursing School Chronicles. I am your host, Lauren Homan, and today I am joined by two of our traditional BSN students. Can y'all introduce yourselves and tell us what semester you're in?
Yeah, I'm Morgan Hallford, and I am finishing up my fourth semester at UTMB.
And I'm Liam Vassal, and I'm also finishing up my fourth semester.
Copycat.
Yeah.
It seemed like a great idea.
You just want to be Morgan, don't you?
True.
So on today's episode, we are going to be talking about a global health initiative that y'all had the opportunity to be a part of in Belize.
Yeah.
That's crazy.
It was wild. Yeah.
So obviously, how did y'all have that opportunity? Like, how did that come about to be able to go to Belize?
Well, I think a lot of it was just right place at right time.
Yeah.
I remember we were just checking our email, and we got this notification of like, hey, this is something that we're trying to do with the School of Nursing.
Yeah.
It's an opportunity that's now presenting itself. Submit an application. There was like an informational session that we could go to kind of hear a little bit more about it. Just throw your hat in the ring. And we both said, yeah, that sounds like a great idea.
Belize sounds cool.
Yeah.
So Hillside Clinic is where we went to.
Okay.
And they have been working, the School of Nursing has been working to build a relationship with them.
Mm-hmm.
And so I think it was more of a, like, let's
trial run.
Let's see what nursing students can do and if they can get a lot out of this relationship we're building. And so, yeah, we got to apply and then did a little bit of prep work. And honestly, it felt like before we knew it, we were in Belize.
Right. So what was the application like? Like, what all did you have to write a paper?
Yeah, we had, I think,
like a couple of essays.
Short essays, because they were like, we figure a lot of people are going to be interested.
So they don't want to have to read a lot.
They were short. Yeah.
Basically, it was kind of suggesting if you'd had any previous global public health experience, since it was the first time they were doing it.
Yeah,
they
or
wanted
a passion or interest
exactly,
for it.
or a passion or interest. They wanted to make sure they got people who were going to bring something to the table.
Mm-hmm.
Not just, a vacation to Belize sounds
right.
fun.
And they put a GPA cap on it, or a
minimum,
barrier, just because they knew
well, it kind of helps them.
They couldn't have gone through all the applications if they
Right.
just said, hey, Belize, open to anyone.
Right.
Hoorah.
Right.
And so we had a GPA requirement in a short application. I think we had a letter of recommendation, maybe. I think so.
There was a letter of recommendation from faculty,
Yeah.
and I think they had the option of an interview. However, they ended up not doing the interview.
And you had to have a passport. And so
Makes sense, right?
I know that's silly, but that was one of the requirements.
Yeah.
And so we applied. I knew a couple other people who kind of, threw their hat in the ring, hoping for it. It was open to third and fourth semester students in the summer. So it took place over our August break when we didn't have school. And so the fourth semesters would have just finished and the third semesters were going into their fourth semester.
Okay.
So it was any of those, and it ended up being
4 third semesters from our semester,
Yeah.
and then 2 who had already graduated.
Yeah.
Awesome.
And so we applied, and then we had a few meetings ahead of time. We got to know each other. Funnily, Liam and I are very close and knew each other before.
Right.
My roommate was another one of the people.
No way.
It was wild. And then another of our cohort that we were close to, and then the 2 others we also knew. So we were able to get
Or a
really
close group.
Yeah,
Right.
we knew or knew of all of each other, which was
Awesome.
cool. And then we had 2 professors who came along with us, who
Awesome.
we also had in class, and we knew. So that was really nice.
Cool.
Yeah.
So walk me through. So you get the, I guess, invitation to go, obviously. It's very exciting because that's a very unique opportunity, very different than anything else you can really experience here.
Absolutely.
So I guess walk me through, so getting to Belize, like.
Yeah.
So we met a few times. There was a big focus on sustainability and what can we bring so that we can be a benefit to Hillside. That was something that they really wanted to emphasize.
We didn't want to just take. We weren't going to take the experience. We wanted to bring something vital to them that they maybe needed.
Right.
Yeah, and so there was talk about collections. We ran some donations, collected donations, things that they had specified they needed or were in short supply. And then also there were a couple of areas that Hillside had identified
as educational elements that they might benefit that we could give to Hillside staff.
Awesome.
So,
okay.
Yeah, they identified some things. So we put together a few presentations about what they had identified was really honing in their vital sign, taking measures and getting the most up-to-date, accurate information on best practices there. And then also like quick EMT kind of
what do you do if no one's there and someone comes and they need immediate first aid?
Right.
You know, they're bleeding. They use a lot of like machetes over there, so cuts are things that are things.
Just basic first aid that if they they weren't going to the ER and the closest place was Hillside, then the staff could access. So we prepared those ahead of time.
Awesome.
And then we also had a few meetings about like what to bring and what the expectations were in terms of, we're representing UTMB going to a different country. And so we wanted to make sure that we were prepared in that realm. And so those were the three main things in preparation. And then before we knew it, we were
on a plane
at the airport, moving up, grabbing our coffees and getting on an airplane together.
How long of a plane ride is that?
Oh, it was pretty short.
Yeah,
like what, 2.5 hours maybe?
2.5 hours.
That's easy.
Yeah. But the thing is, we flew into
Belize City,
and that is not where we ended up.
So
Belize City is quite north on the coast. So Belize, I embarrassingly thought this was an island. It is not an island. It is on the no. Anyway, so it is just south of. It's on the Yucatan Peninsula, just south, and the city we were in is the very furthest south. City in Belize.
No way.
And Belize City is quite north.
Oh, gosh.
And so it's a 6-hour drive.
So the
bus ride through the jungle.
The drive was longer than the plane ride.
It was a lot longer.
But
it was actually, they had a driver and we were with him the whole time and he was fabulous. But he drove us all the way through and kind of pointed out places and we got to see a beautiful, beautiful country. And we also got to chat with each other and get to know each other on we spent a lot of time over the whole time, but the 6 hours to start was really nice to really bond,
right,
and share snacks. And we stopped at a gas station and got Belizean snacks. And so then we ended up in Punta Gorda, which is the town where Hillside is located.
Okay,
yeah.
So tell me a little bit about the clinic and what that entailed.
Yeah.
So the clinic was a group of specialties. So they had a primary care area that kind of saw patients who would come in, same as any clinic.
Right.
They had a physical therapy area with PT students from across the United States that would come and perform, assess, treat for physical ailments. And then they also had a home health nurse who would go and treat patients who were either so remote they couldn't get to the clinic or had some sort of physical handicap that prevented them from getting to the clinic because the public transportation wasn't the best over there. It was a lot of like, hey, let's bike the several miles to the clinic on the dirt road.
It would be hard on your body to take the buses too. Like the roads are this is Punta Gorda is fairly remote, 6 hours from the capital city. But then a lot of these people are from further in the jungle, further towards the border away from the coast. And so it's a long journey to any of these people to get to Hillside. They're going there because they're not getting to there's kind of closer hospitals. It's kind of a satellite region in the sense that the biggest hospitals that have the most specialties are in Belize City. And then as you go out, it's more generalized. And so a lot of these people are traveling really far just to get to Belize City. And they're going to get to Hillside, and they're going to go for the day. So they take off work and they take the bus. It's a whole journey. They sit and wait and then they're seen and then they take the bus home. So it could be a whole day ordeal for them. And so another thing that Hillside offers that we didn't get to experience just because of the time of year was they also do mobile clinics. And so they take their clinic out to these more remote regions to do glucose screenings and more of the public health element, I think. And then people will, if they have an ailment that maybe is not as necessary to come in right now, but they're like, I have a spot on me or something I need to think about, they would wait till the mobile clinic Hillside comes. And so that might be the only
time they get those
time
services.
that they get those services.
Wow.
And so Hillside is doing a really important job in this area of Belize.
They kind of service as the primary care for that entire southern region.
Yeah, it's
which
wild.
is pretty huge.
Yeah,
for such
something that's really cool about Hillside is it is Belizean run, and so it is not one of those. Global health exists in a lot of different visions, right? There's a lot of, you can see it, and it's not always the same. And Hillside was set up and has now been run and well loved by its community. It is not something that was placed and dropped there by a foreign entity and then left to kind of rot because it doesn't have the sustainability. And that's something really special about Hillside is that the people who are there are in community with the patients there.
Yeah, that's their people.
That's their people. That's their neighbors. And so it's really, really well loved and really looked after.
That's awesome.
And then what people are able to come and visit and contribute is just more the better, but it's not something that they need. I mean, obviously everyone's going to be happy for donations and things, but they didn't need us to be there for their clinic to run.
Which is awesome.
And I think that was a really unique element for us to learn in a global health setting that was sustainable and was going to be there whether we were there or not.
Right.
And so that was something I got a lot out of it.
That's awesome.
Absolutely. I think that's the part that drew me, or the part that I appreciated the most, especially looking back at it, was it wasn't just an experience where we came in, we did a little bit of something, might have been helpful initially, and then we left, and then people are left without resources. It was, we came, we learned how they run their healthcare system. We learned what part we could fill in that. We did what we could for the week that we were there.
And what did you do?
Oh, we shadowed.
Yeah.
A
So
lot.
we split up. We had 6 of us, and we split up 2-2-2. And one day,
Were you paired with Liam?
No,
No,
it wasn't.
man.
I know.
Rude.
I know. But so we split up and we did a day shadowing the PT students, which was hugely helpful. This is a very physical population that doesn't necessarily grow up learning, ergonomics and how to move their bodies properly. So like if you're lifting wood and you're throwing it around, you might not be bending.
You're lifting with your back.
You're lifting with your back kind of thing. Exactly.
Right,
So
right.
we got a lot of that. And then another rotation was in the
clinic itself, where
doing the day-to-day seeing patients who were coming to visit.
Wow.
Yeah, and for that we got to shadow a nurse practitioner just to
cool.
kind of show us a little bit of what we could do if we went and got further education.
Right.
You can come back and actually be a provider for the clinic.
And in that we saw from the triage and getting vitals all the way to the end of getting their prescriptions filled at Hillside before they went home. And we got to see that whole process.
Wow.
And then the third, and I think the most notable for all of us when we left, was the home health nurse. So we went with Nurse Jenny and to these different sites, in homes, in Belizean homes, to care for patients.
I love that.
And it was really amazing to
Eye-opening,
see.
huh?
Eye-opening because we saw different patients on different days, but some of the patients she sees every day. So we got to have differing but also similar experiences. But the care that she was able to give with limited resources, she was doing wound care without, these sterile wound care kits.
Right.
And she was able to care for these patients with her resources to a better level than they may have seen elsewhere.
Wow.
And it kind of brought back all of nursing to, you have to care
Right.
and you have to be thorough with what you have,
Right.
and your patient will be better for it.
Right.
It doesn't necessarily mean you have the best. We use technology and it's amazing for us, but at the end of the day, you're caring for your patient with what you have, and that's what nursing is.
Right.
There's no substitute for just a passion for it and
Right.
willingness to go through all the steps and make sure that you are thorough and do things that you want to do.
Yeah.
Wow.
Yeah. So that was one. It was really also helpful to get us to be immersed in the culture in a way that you don't normally when you go travel abroad.
No,
We
that's
don't
a
get
different.
to go.
That's a way
You
different
don't get to
level.
go into people's homes all the time.
No.
And they were letting us in their homes. Sometimes there was a language barrier, sometimes not. But there was a great learning opportunity in interacting with patients that you don't know a lot about or you're
Right.
learning about as well. So the bedside manner was also really helpful.
Yeah, I think it was one of the first times in my life that going abroad, I've not felt like a tourist, but more of an observer.
Yeah.
I was there to watch. I was there to learn. I was there to listen and see how life is somewhere else.
Right.
So we did those 3 rotations for 3 days for the first half of the day. And then the second half of the day, we would do other activities, whether it was like we took a cultural class Hillside put on for us.
Really?
Yeah,
That's cool.
they taught us more about the Mayan people, and there's a lot of different populations that you wouldn't expect in Belize.
Right.
And we got to learn about each one of them. They presented that to us. And then we got to go to a sustainable farm and see how they grow the food that they're eating and
That
make
is
chocolate.
so unique. That's cool.
Yeah, it was amazing.
Yeah.
And then we went to a Mayan
We
ruin.
went to some ruins, yeah.
Really?
Yeah.
Did you
and
take lots of pictures?
tons. And it was also raining that day. It was just such a, like, we were in the jungle at a Mayan ruin. It's raining. And it was just like
It's a perfect setting.
and we went to like a river and swam. And it felt like we learned a ton and also had this really enriching cultural experience all at the same time. And we were able to give back, and it was just so full. The whole week was so full.
Well, one of the things that we'd ended up doing to give back was on one of our afternoons, we walked through the city of Punta Gorda, and we were able to kind of assess things that were good, things maybe that had room for improvement, just all the different factors that led to the health of the people there.
Right.
And then we presented those findings to Hillside Clinic to hopefully give them a better gauge of directions they could go, things they could do.
Your
Just
recommendations.
in a set of fresh
Yeah.
eyes. They're there all the time.
Right.
And things start to feel normal.
Well, and you're from a different culture too, so
exactly.
that provides a different.
When you live in that
outlook.
location, you're like, that's normal. That's not strange. And it's like, well, with fresh eyes, you can say, well, there are shockingly large amount of Coca-Cola signs here, like we're, that kind of thing.
Right.
And we got this really enriching opportunity to give something back to them. One of the afternoons we did do our teaching. We showed kind of best practices.
So
for
y'all
the vital
got
signs.
to do the teaching,
And we
not
got to
the faculty
right.
that were
No,
going to do.
this was us, and we split it up, and we did kind of a vital sign lesson, because they're taking vital signs all the time, but it's like, hey, that cuff might be too big, and I know you don't have tons of cuffs, but it might be worthwhile to do a smaller cuff on this to get a more accurate reading, or things like that. And then the triage element of it.
Kind of like a first aid, someone comes in with a cut, someone comes in with a broken limb. There's none of the actual providers here. You have to wait for a ambulance to get here or someone to get here to take them to the hospital.
Right.
What do you do in the meantime? How do you escalate? How do you stay calm? Kind of a practice so
Walking
that you
them
can,
through that.
exactly.
Because one element that any global clinic is getting in a really remote area, they're not getting the EVP that the med center is getting.
Right.
And so they are really, I think, thirsty for that knowledge of what's happening right now in healthcare that we can use.
Right.
We don't want to outdate ourselves, but we're also here in a clinic that's remote, and we're not necessarily always having these projects of best practices. So that was something we were able to give, which was great, because we got so much out of the experience that I think we were happy to give anything to them that we could.
Because y'all already had gotten so much from them, and just being able to give back.
And even it was really cool to step into the role of a nurse educator. Like we've been learning how to educate, and that's something that's stressed is very important in the field of nursing. we got a chance to practice our education, really just, find different ways to word things, find different ways to, teach a community that has never heard some of these things before or might have learned something completely different.
Yeah.
It might not be the best
we
thing
definitely,
to do.
It was tricky because we're, hypertension doesn't mean a lot to someone who isn't in the medical field, but also maybe English isn't their first language.
Right.
And
of
so
course.
that was something that we kind of had, you have to shift your brain. When you're in nursing school, you're just so focused on the words all the time. And you're like, I need to step out of that for a second.
And you kind of took a step back and
talk
were able
like a
to,
normal person.
Right.
Yeah.
That's important sometimes.
And then we also got to get really close to the professors who were on the trip with us.
That's
and
awesome.
We went to dinners and we kind of explored. We were in a little in
like a bed and breakfast.
Bed and breakfast type place with these big rooms, and we would stay and we'd play games in the evenings and get really close with each other and learn. The cool thing about us all having either a passion for global health or having had experience abroad was that we had a shared interest. And so we got to, Professor Sadler was with us, and she has amazing global experiences. And we could ask her, how did you get into that? How did that shape your nursing? And learn from her, and Dr. Carson in the same way. Like, they have such rich stories of their experiences that we got to learn from. And also they got to know us better.
Well, and I love that y'all were able to do that outside of the classroom.
Yeah.
That's a totally different setting too.
Yeah. And I mean, where it was warm, it was August, we're sweating, we're not looking
humid?
our best. It's a little bit humid on the coast. And we just kind of got to see each other at our, we were silly and we were...
You let your hair down.
We let our hair down.
Dare I say most natural.
Yeah. And it was such an enriching experience to learn from our professors in a different setting, learn from this unique opportunity. And also, I think, prove to ourselves that we'd learned a lot in nursing school. And that we could be helpful in these settings.
Like you know more than you think you know.
Yeah.
Finally felt like I could be a competent nurse.
Yeah.
I mean, you're going to be a very competent nurse.
So we were so grateful to go, but I think we all got such different experiences than we thought we were going to get out of it. And at the end of the day, we're better for it, and we hope that Hillside is better for it. But like I said before, they're chugging along, so they're fine. But
that's just such a unique thing. I mean, like I was saying earlier, I didn't know much about this trip, so this is a very cool opportunity that y'all were presented. Sounds like neither one of you had regrets going. In fact, had just the best time and learned, and again was able to give back, which is always rewarding, especially you're in the trenches of nursing school, and it was good that you were able to kind of remove yourself, but still. It was still school.
Step out of the school element, but still in nursing. Yeah.
And just be a good human and go and help.
And I think that was something that we also all took away. And I don't speak for everyone, but I've heard them say.
But I do speak for everyone.
I do speak for everyone. But everyone left saying, I want to do this back in Belize, or I want to do this elsewhere. Like,
it lit a fire.
It did. Yeah. And there's something so exciting about bringing healthcare to people who are in these remote areas, because healthcare is changing as we globalize. What we deal with here in terms of what we eat and how our bodies are reacting to the world we live in is going global. And in a lot of ways, it can be really negative. I know, like, Coca-Cola in itself has been really hard on these local communities, where one of the things we noticed was Coca-Cola is cheaper in some situations than water.
So they're going to get
it. And they are
safer too. Where it's disinfected, it won't give you any diseases or have any parasites.
But it will give you diabetes.
It will give you diabetes. But there's not a lot of education about it. Whereas here we learned that was a very real risk
Right.
before.
Right.
And now we're going and they're like, oh, my sugars are high and I don't know what that means for me.
Right.
In a rural setting where you don't have great healthcare, you don't want to have diabetes. That's really hard.
No.
And so those are the kind of things that we don't think about here in Houston.
Right.
That are affecting the world.
Right.
And
so y'all were able to see that
we
firsthand.
can see that. And we now have I think we have a fire under us that is saying we want to change this because it's affecting everyone.
Right.
So
if I may tag on to that,
Yeah.
As far as the fire goes, something else that was really interesting to me was that we saw all of this in Belize, and then we come home and we realize that there's situations like that, there's clinics like that, there's people who don't have access to healthcare like that here.
Right here.
Right.
You know,
So you
in
can
our
help your
country,
own.
right on the Texas border.
Yeah.
And that's a place much closer to home that we could have
Yeah.
the
And
exact same
impact.
impact.
Yeah.
These
do the exact
people
same
are coming
things.
into the ER in the same way with that's their healthcare setting. That's where their primary care is, the ER, or they're not going to the doctor.
Right.
I mean, we have free clinics here on Galveston Island that are in the same need and have the
It's
same
right down the
things
road.
right down the road.
Right.
And so, yeah, we didn't even need to go to Belize to do it, but it was something where we learned so much that we can take into our day-to-day here.
It was such an eye-opening that you wouldn't have gotten anywhere else.
We wouldn't have realized what was right under our noses here without having done it. So
Right. So
yeah, we're
great
super
experience.
grateful. Yeah, it was really
Yeah.
something we were excited about, but definitely didn't have an idea of how enriching it would be.
And impactful.
Yeah.
Awesome.
Yeah.
Well, thank you guys for
Sure.
chatting with us about Belize and your life-changing experience.
Yeah.
It's always a joy to be able to chat with y'all about different things. So, and thank you so much to our listeners for tuning in to hear about our students' trip to Belize, and we hope y'all join us back for another episode. You've been listening to Nursing School Chronicles, brought to you by the University of Texas Medical Branch School of Nursing. For more information, please reach out to the UTMB School of Nursing Admissions and Student Affairs Office. Our number is 409-772-8271, or visit us on our website at nursing.utmb.edu. All of the opinions expressed on this podcast are the opinions of those speaking and do not reflect the policies or stances of the University of Texas Medical Branch School of Nursing in Galveston.